Commissioner, thank you
Wonderful.
so much for making this meeting. You are doing a fantastic job, but this is a very, very difficult problem we have in the greater Springfield area, the fentanyl. Could you just address where we are and where we're headed with this horrible drug that's on our streets?
Certainly happy to. The city of Springfield since 2019 has had the Greater Springfield Opioid Overdose Collaborative. Community-based organizations, along with the Department of Health and Human Services, have been meeting monthly since 2019. In 2022, we commissioned John Snow Institute to do a report for us on the opioid crisis, and we have that report. That report puts forth some recommendations that are in categories such as creating a friendly, increasing access to care, recommendations around access to care. We are currently in the process of working with the community of individuals who have lived experiences, meaning those individuals who are potentially addicted. We are doing on-the-street surveys in order to determine what are those strategies we should put in place for the city of Springfield. I have two documents that I can share with the council. I have not sent them, but I will send them to you so you can review the recommendations from the task force and the recommendations from the John Snow Institute. The other thing that we've done is we've created a plan for the city of Springfield. That's a separate document. I'm happy to send that to you as well so that you can look at the recommendations as they currently exist. I apologize. I am not currently in Springfield, and so I certainly could have sent those ahead of time. But some of the things are creating an opioid response plan for the city of Springfield. We have to do that. We have to get real-time data collection systems that allows individuals with lived experience to have a voice. We have to do an assessment of who is currently doing that work, the work in our city around opioid and fentanyl, and how effective is it? We use the data from the State Department of Public Health, and we are using that data in order to create the response plan. We have hired an opioid overdose coordinator for the city, and that individual has been working since last January, I believe. So I will send you the documents that I have. Some of the other things are around workforce capacity and process, making sure that those individuals who are treating and working with our community look like and are culturally responsive to the individuals who need their assistance. So workforce is another area that we're looking at. I have probably gone on too long. I'm happy to answer questions if that would be helpful, but I will send you the documents that I have and the documents that we created for the Access Center for our city. We believe, from a public health perspective, that our residents shouldn't have to go to 10 different places in order to get the help that they need, that somehow we need to create an access where we have organizations working together. And the last thing I'll say is we have purchased a medical van that will be mobile and will go into those areas where there may not be services in our city, thinking about Indian Orchard and other areas that may not be very accessible to our residents. So that's kind of a brief overview. Again, I apologize for not being able to be on camera. I will get these documents over to you.
Thank you so much. When you mentioned about the care section, the care area, is that behavioral health?
The care area is a couple of things. The care area is behavioral health. So we have entities or organizations that are dealing with behavioral health, but we also, medical treatment can include at times for individuals methadone. It can include treatment centers. It can include making sure that we are paying attention to the social determinants of health that are impacting residents with lived experience. So we do have a care coordinated team that sits in many organizations, but I believe those organizations, we need to create one comprehensive plan so that we're giving a warm handoff to people who have addictions and not having them go 5 different places to get 5 different kind of treatment modalities.
Helen, what I got from the state, I want to get your input on it. It says here among the overdose deaths in the Commonwealth, last year were about 2,359. And it states here that fentanyl was present in 93%. Does that sound about right?
Well, that's hard for me to say because the State Department of Public Health does do tests across the state to be able to see what are those components in our in the narcotics. What are the components like fentanyl? So in different parts of the state, Counselor Santinello, the overdoses and what their experiences might look different. So I don't know if that 93% represents the city of Springfield.
Okay. The other question I had was, I spoke to one of my former colleagues last week, and he stated to me that there's a rise in tainted, laced marijuana, street marijuana, not the legal stuff from the state, but on the street marijuana, laced with fentanyl, laced with PCP, laced with heroin. Are you aware of how bad that might be?
I am not. I think that it's very difficult, again, when individuals are in the street and buying narcotics, any kind of narcotics, not just marijuana, what it's being cut with, what's being added to it, is something that's very difficult to quantify because we don't really have the, I don't really have the data to be able to say that. Now, who you spoke to could be absolutely correct, but the question becomes, how are we able to quantify that? What is the process that's being used to say, yes, that is the case? And that's what I don't know.
Yeah, I wish we had somebody from the police department here on this call. That'll be on a follow-up because they're right on the street.
We have the police department here, Counselor.
Oh, we do?
Sergeant, no.
Oh,
Sergeant.
oh, Sergeant Bruno?
Yes, I am here.
Hi, Sergeant Bruno. How are you?
Good, good.
Are you seeing that, Sergeant, on the street, marijuana being cut with other drugs?
It is.
Street marijuana.
It certainly is. And it's not just marijuana, but it's all classes of drugs. So people who illicitly purchase marijuana, cocaine, heroin, it is all being laced or cut with fentanyl. And so there is an epidemic that's ongoing. And so it is a problem. But certainly the factor or the cause of overdeaths is that it's being laced or being cut with fentanyl. So you are correct in that aspect.
Now, it's my understanding that the fentanyl can be as small as 2 grains of salt that can kill you. Is that correct?
That is correct, because it is about 100 times more potent than heroin. And so that is, again, that is the problem. Certainly when you purchase drugs illicitly or out in the street, you don't know what you're getting. And like the commissioner had mentioned, Commissioner Colton Harris, you purchase marijuana, but in reality, you don't know what you're getting that's laced with the marijuana. So it poses a danger to our community in all actuality. Even individuals that do purchase heroin or cocaine, you may purchase what you think is cocaine or heroin, but unfortunately it's being laced with fentanyl. And so it's become a huge crisis.
Sergeant Bruno, are we doing anything for, what do they call, public service announcements? You see them all the time for other things, other health, concerns. How come we're not seeing more public service announcements on fentanyl to make these young kids aware, everybody aware of these dangers so they can see it or the parents can see it and they can take action?
I think that is a push from the state. Obviously, there is a source of funding that always comes into play to get this announcement brought out. And so I think the city needs to explore that. There is funding for the opioid crisis. And certainly the opioid crisis is at a crossroads with the fentanyl crisis because, again, when you look at the opioid market, everything is being cross-contaminated with fentanyl. And so in order for us to get ahead of that and advertise and make awareness to our community, we need a source of funding to get that done. There was a presentation by the Attorney General, I believe it was in 2016, where there was a push to make our younger populations aware of the dangers, but unfortunately, it stops or we forget about these things, and it has to be continuous, or else the announcements or the awareness goes by the wayside, and we forget that we need to continue to make these announcements to make people aware of the dangers of the fentanyl prices that we have.
I know that, there was, an article, last week in the paper, how the state had to cut back on certain programs because of the shortfall in revenue. And I saw that the behavioral health side got cut. Are we aware of that, Helen, and how severe were those cuts?
So I personally, the Springfield Department of Health and Human Services did not receive cuts to our grants, and we do have a grant that specifically deals with, I work with Springfield Public Schools, Holyoke Public Schools, and Chicopee Public Schools to make sure that we are doing as much education as we can with the students in those three cities and towns. The Springfield is the lead entity for that. So there is education that is happening in the schools, and we try to continue to do that. We also work with community-based organizations, New North Citizens Council, as well as the South End Community Center, YMCA, whomever we are working with. So when you ask if we received a cut in those programs, no, we have not. I am not sure about behavioral health. Certainly CHD and others, Behavioral Health Network, would need to answer that question if they're on the call.
Thank you. Tracy, you'd like to say something?
Thank you, Mr. Chair. Sergeant Bruno, what evidence do you have about the lacing of the marijuana? Has there been deaths or severe injuries, and about how many, if any, have you came across?
We get weekly overdose reports that we have. We collect by the responses of the officers. The way that the overdose is determined is if there is a positive response to the administration of Narcan. When an individual is exposed to fentanyl or heroin, again, to reverse that opiate overdose, the way to do it out in the street by police officers is to administer Narcan. We do reports for every incident, and so we have documents of this. We have, unfortunately, overdose death reports that are in our internal incident reporting system. And so the proof is there. I think, like the chair said, in the commissioner had mentioned, we need to get on the forefront with advertisement, making children aware of the dangers of fentanyl. When you look at the minimal amount it takes to overdose, we have younger children. Again, the state has legalized marijuana, but because the taxation on the legalization of marijuana drives other individuals to purchase it illicitly, they expose themselves to the dangers of the possibility of lacing or having these drugs contaminated. And so that is the message, that although you may purchase what you think is marijuana, there is a possibility that, again, it may be laced with a dangerous substance like fentanyl that may create an overdose. And so when you look at the data is there.
Well,
To
I
go
want to see the
beyond that,
data. To say it's there and to see it are two different things. I do believe that you have it. So I'm only looking for the one specifically that relates to marijuana being laced, because working on the opioid task force for a very long time now, I'm aware of the opioids, how it's affecting the community. But this is the first that I've heard about it as it relates to marijuana. And I do agree with you on the messaging, especially with the young kids, because those are the ones who can't go into the legal facilities and purchase marijuana. Doesn't mean it's going to stop them from smoking. So they are going out and purchasing the illegal marijuana and other drugs, vapes, and all those other things that they do. So I think you're right that the messaging is important, but I just want to see some data behind the marijuana facts that you have.
okay, I can certainly research it more. Right now, what we do have is, again, any overdose or any administration of Narcan is how we base our data. We would have to go through every report to see if it was marijuana as the cause. A lot of times we have to understand having an overdose is an unfortunate situation. As it is, people, when they overdose, when the officers arrived on scene, there's usually nothing there. And when the officers arrive, we don't know what they took. But what we do know is that the officers arrived, they administered Narcan, and then they revived them. And so
Gotcha.
the data is going to be hard to collect, even if we know that a person is a heroin user, perhaps, or is addicted to other substances, because it's an unfortunate disease. And a lot of times when we respond to these scenes, the evidence that we have is just the administration of the naloxone. And again, you are correct, Tracy. It's our younger populations that we really have to divert this attention to, because they are the ones that are curious. They are the first time users. And so what we don't need is that the inexperienced person trying to experiment for the first time that loses a life. Our evidence
That
is
is true.
that one call by a parent who says, my child was smoking. That's where we have to make that explanation. It was just marijuana. We can't say that because we know there was something behind that. And so, Counselor Whitfield, I would say we need to join together to make that message known within our schools.
Yeah, that's
I
sad.
agree, I agree.
I actually know someone personally
The
that
sar- Oh, go ahead, Tracy.
I actually know someone personally that child tried something one time, and that was a good child, just very good child, good grades, but just giving into the peer pressure, tried something one time and passed away. So that's very sad. Mr. Chair, I just have one more question, comment for Commissioner Carlton Harris about the opioid settlement funds that we get into the city, and we will be getting, I think until 2038, based on all the cases that Governor Healy or the Attorney General's office won. And I kind of is more of a comment, I guess, that we make sure that we have public input on how those funds will be used, because I think I mentioned in the city council meeting, when it comes to opioid, gun violence and other things, even messaging to the youth and youth involvement, all of it really ties together. And so we want to make sure family support is there. We do address gun violence. We do address youth using it. And I just want to ensure that we hear everyone's perspective before we determine how those funds will be used. I know that you don't have all autonomy over that, but I did go to a meeting with the Bureau of Substance Use, I think, with the CARE team. I think it's CARE Coalition or something like that. And they were saying that they strongly advise community feedback and community input with how those funds are used. So I'm not really sure what your involvement is in to date, Commissioner.
Councilor Whitfield, I believe strongly that people support what they help to build. And so I will never do a public health intervention that does not include the community, that does not include the executive directors of the organizations that we need to hold accountable, the individuals we pay to go out and do the outreach, as well as those with lived experience. So there will be community meetings. I am working with Bay State, and I'm going to continue to work with Dr. Robinson even after he retires to be able to pull those meetings together. We are doing surveys on the street right now with individuals with lived experience with 5 simple questions, asking them to advise us on what they believe their needs are and we should do. And I'll just say one last thing. Families are important. We do not have individuals in our city who are addicted alone. The whole family is impacted. So I agree with everything that you said, Councilor Whitfield, and I have said to everyone who has asked me, we will not move forward with a plan without the community voices involved. And I will send you the 2 documents I have where you can see we've already done gotten some feedback from individuals with lived experience. So thank you for asking the question.
Thank you, Commissioner. Sergeant Bruno, how bad is this fentanyl distribution in the city of Springfield? I mean, there's been reports that Springfield is like a hub for New York and for Hartford and for the surrounding areas. It's Springfield. Are you seeing that?
The issue or the reason why you hear reports of Springfield being the hub is that it doesn't necessarily mean that it is central to where everything is distributed from. It's a central city that connects off of I-91. And so we have a large city. It's a populous city. And so from here, yes, there is a arrival point, but then it goes to other parts of New England, not just necessarily within the city of Springfield. And so that's why you hear these cases. But the Springfield Police Department is active in trying to dismantle these drug operations that are certainly involved in the distribution of fentanyl, and we will continue to do so. Certainly, it's what we can do, and we will continue to do it.
Sergeant Bruno, are you in the narcotics division?
Yes, I am.
I don't want any numbers about how many narcotics. There's people listening, but do you need more people in the narcotics division?
Chairperson, you cut out. I couldn't hear you. If you could just repeat the question.
In the narcotics division, you see, and I don't want to give any numbers out how many we have, but do you need more people? Do you need more help in the narcotics division, and perhaps the city council can fight for those funds?
I think as a whole, the department, we are currently in a phase where it's become a challenge to hire police officers throughout the entire city of Springfield, not just necessarily a unit. Every member of our department is involved in the role of trying to prevent illegal activity, saving life. And so what we are seeing is that we need our rank and file to grow. Certainly the department has faced a large number of retirements, and we are trying to keep up with recruitment of officers coming on board to the Springfield Police Department. So certainly we need additional younger people, men and women, to join the police department. Again, because we do need help in protecting this great city. And so we need additional police officers, and we need individuals to apply. But
Thank you
this
so
is a problem that's faced by law enforcement communities across the United States.
Thank you so much. Tim Allen, are you there? I see Tim on the screen. Okay. Tracy, are you still there? I guess not.
I think Counselor Whitfield put in the chat that she needed to leave the meeting, I believe.
Okay, so you're gonna get us those documents, right, Helen?
Yes,
And then we'll have a follow-up meeting, and whatever we can do to help you as a city council, you've got my support 1,000%. And that goes for you also, Sergeant Bruno.
Thank you very much, Counselor.
And thank you
thank you, Counselor.
Mr. Chair.
Yes, Tim.
Yeah, sorry, I was having trouble unmuting myself. I've been on the whole time. I just have a couple questions for Helen.
Yeah.
Helen, you mentioned that you have a committee that meets once a month or something, and in concert with some nonprofits, North Citizens Council, etc. Is that the same thing as the Wednesday afternoon meeting on the second Wednesday of the month? There's a big meeting at the UMass Center. Is that the same thing, or are those two different things?
There are two different things. The HCAT meeting focuses on Hampden County. Greater Springfield Overdose Collaborative focuses on the city of Springfield specifically.
So there's some overlap with the same. I've been to that meeting a few times. That Wednesday one. Is there some of the same people in both places?
Yes, there are some. There are some that overlap, and there are some that do not.
Okay. Is that a meeting that the Springfield only one? Is that a meeting that I could attend or we could attend if it worked out on the schedule?
Absolutely. We welcome your attendance.
All right. Do you know when that is in the week or in the month?
We just had one on Tuesday, I believe. So I believe it is the second or third Tuesday. But let me have you added to the invitation list. The other thing I'm hopeful about is that when we are going to do these community meetings across the city, we'll have a really large one to open it up, probably at the Carriage House or the Jordan Center, so that we can begin that process. And I'm hopeful city councilors will show up at that as well.
Can you make, you make sure that we get an invitation to that, Helen? I'd like to attend also.
Oh, absolutely. I will send it to the entire city council. I think that legislatively, it's going to be important for the city council to be as aware and to hear from those with lived experience, those individuals who are currently addicted and using, so that you can hear their voices separately.
Great.
Okay. Thank you.
Thank you, Helen. Thank you, Tim. Thank you, Sergeant Bruno. And this meeting will be continued at a future date, and Helen will wait for those documents to arrive and we'll review those. Thank you so much.
Okay. Have a good day. Take care.
Thank you too.
Thank you.